What research is being done with gliteritinib to make this therapy more effective?
So investigators are evaluating the use of a FLT3 inhibitor with other targeted therapies, intensive chemotherapy, and immunotherapeutic approaches. So for example, the use of gliteritinib with the BCL2 inhibitor venetoclax has shown an 80% response rate in patients with relapsed refractory FLT3 mutated acute myeloid leukemia. It's also being evaluated in combination with intensive chemotherapy compared to intensive chemotherapy with midostaurin in patients with FLT3 mutated AML that are previously untreated. And of course, other inhibitors will be developed with FLT3 inhibitors. For example, nucleophosmin mutations quite commonly occur with FLT3 ITD mutations. Menin inhibitors have shown single-agent activity in patients with acute myeloid leukemia with nucleophosmin or NPM1 mutations. And clinical trials are being designed, and some have already started, with menin inhibitors in combination with a FLT3 inhibitor such as gliteritinib in patients with relapsed refractory AML that have both a FLT3 and a nucleophosmin mutation.
Are there other FLT3 inhibitors in development? What may make these better than gliteritinib?
FLT3 is one of the three most common mutations that are found in acute myeloid leukemia and are part of leukemogenesis. And so it makes sense that multiple inhibitors have been developed that target FLT3 and, in general, have shown single-agent activity. I think it's fair to say that the three FLT3 inhibitors that are the furthest along in clinical development in acute myeloid leukemia are gliteritinib, quizartinib, and crenolanib. Now, these are all second-generation, more specific and more potent FLT3 inhibitors compared to drugs like the first-generation midostaurin, which is already approved. And so those FLT3 inhibitors all of them are being studied in combinations with chemotherapy, other targeted inhibitors such as BCL2 inhibitor venetoclax, with less intensive therapies such as the hypomethylating agents, and with immunotherapeutic approaches. At this year's Congress, EHA 2022, I am presenting the results of the Quantum First study, where we show that the addition of quizartinib, a second-generation type 2 inhibitor of FLT3 ITD, has shown a survival benefit compared to placebo in patients up to the age of 75 with FLT3 ITD mutated acute myeloid leukemia.
So there are definitely other FLT3 inhibitors in development. There's a drug called quizartinib that is the results of a clinical trial are being presented at this year's EHA meeting. I think it's being presented tomorrow. That's a study of quizartinib in combination with chemotherapy. We'll have to see what the results of that trial are. In terms of whether anything is better than gliteritinib, I'm not sure. I think gliteritinib is very potent. I'm not sure there's anything that's actually better out there that's being investigated. I think the question is going to be, is the efficacy of gliteritinib in combination with chemotherapy going to be similar to the efficacy of a drug like quizartinib with chemotherapy?
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.